This morning, millions of people are one step closer to getting their COVID booster shot. The FDA giving authorization for additional shots of Moderna and Johnson & Johnson vaccines for some people. It's also supporting the mixing and matching of doses of the vaccine so you can get a different brand than the original shot you got. Wake Up Charlotte's Richard Devane now live for us. And Richard, the final decision of these booster shots now in the hands of the CDC.
Yeah, that's absolutely correct, Ben. Good morning to you. Good Thursday morning, all. The CDC will be looking at this all day today, talking over the data with each other and then making a decision. A lot of folks hoping that they'll approve it. Then we'll be able to all have those booster shots. Those are for those folks who've already taken their initial doses. More Americans one step closer to getting that extra dose of protection from COVID. On Wednesday, the Food and Drug Administration had authorized COVID vaccine booster shots made by Johnson & Johnson and Moderna, including allowing mixing and matching. This approval comes after an advisory board gave unanimous approval for additional shots of both vaccines last week. The committee recommended a third Moderna shot for elderly at-risk individuals 6 months after their first series of shots. Anyone 18 and over who received the Johnson & Johnson shot more than 2 months ago also eligible to get that second shot. This authorization would open up booster shots to the 15 million Americans who got J&J and the 69 million people who got a Moderna series of shots.
Mixing and matching gives us an advantage by broadening our defenses and making sure that, we're not fully that one step behind. Maybe we're just half a step behind. Different strains are being protected by mixing the doses.
Basically, what the doctor was saying there is that Moderna and Pfizer and Johnson & Johnson also protect differently against different strains. They have more power, so by mixing them, you could get better immunity against the different COVID strains. We're here in Charlotte. Richard Devane for Wake Up Charlotte.
Remember, even if these booster shots are approved, not everyone is eligible to receive that extra dose. So let's take a closer look at who would likely be eligible. If you got the Moderna shot, the FDA authorized boosters for people ages 65 and up, people with underlying medical conditions, or people who are at a higher risk for COVID due to their job or living arrangement. The qualifications are very similar to those for the Pfizer booster, which is already available. But for Johnson & Johnson, the rules are a little different. The FDA is recommending everyone who got that vaccine to get another dose. Remember, the J&J shot was originally just a one and done shot. The FDA now saying a second dose 2 months later. A second dose would offer better protection for everyone.
Let's take a look at COVID-19 by the numbers here in North Carolina. Our daily case numbers continue to drop. Yesterday, about 2,600 people tested positive for COVID-19 across the state. Right now, about 6% of tests are coming back positive. And look at the overall trend of those cases. You can see we are on a steep decline. Our daily average back to where it was at the beginning of August. We're also seeing fewer COVID patients in the hospitals right now. 1,800 people currently hospitalized with COVID. That is 2,000 fewer patients compared to what we saw back in early September.